going to the airport to flee the country before we get fully locked down.
The traffic is only inside Manila, but this exitway, it will only take me 45 minutes for 60 kilometers. But now it says we will be stuck here for 109 minutes. Ay pong salamat. They said that we will ask the police up there, and they're saying that if we have valid reason, like we have international flights, they might allow us. Makakadaan ba kami airport?
My name is Nina de la Cruz, and I'm from the Philippines. I work with two other female doctors. Their name is Nicola and Natasha. Both of them tested positive for COVID-19 after working with COVID-19 patients. And I think this whole COVID crisis has brought us all together.
So my name is Natasha Khan. I am a doctor working in the NHS. I'm an Irish-born Pakistani that grew up in Dubai. So we met on our plastic surgery rotation, and we just instantly clicked with each other, I think, and have been friends since. And I think it's a really good thing to be friends with your colleagues, because at the end of a long day, they're the only ones who really understand what you've gone through.
I'm Nicola Quinan. I am a doctor that's been working in surgery within the NHS, and I'm from the UK. I think this was towards the end of January when we were hearing about what was going on in China. Everyone at the time kind of happily talked about it as, yeah, that sounds bad over on that side of the world. But I remember feeling quite worried that surely it's just a matter of time before it starts.
I've been planning to go home after 2 years, and I was supposed to have basically some time to visit my family and to spend holidays. But this was around the time when coronavirus began spreading. The president of the Philippines announced that there'll be a lockdown of the country, which means international flights will be stopped. A lot of the flights have already been cancelled, or they are not to be permitted after those 3 days. We needed basically to rebook our flights immediately, and there was military and police presence all around. We didn't know whether we will be able to pass through different borders and checkpoints. I was afraid of whether we will be able to make it out in time, or if I'll be able to fly out to go back to my work.
In case of rapid change in cabin pressure, oxygen masks will automatically drop from the compartments above you. Immediately grab the mask and pull it towards you. Put it over your nose and mouth. Pull elastic bands sideways for snug fit and breathe normally. Put your own mask first before assisting others.
We are now at Heathrow Terminal 5, and as you can see, it looks like just a normal day at the airport at 8 o'clock. Except I'm wearing a mask and everyone else is not. I feel a bit anxious about what I've been hearing for the lack of PPEs or access to PPEs for medics. I'm not sure myself. I mean, I haven't been there, but I will find out on Monday night.
This is St. Mary's Hospital. It's one of the major trauma centers in the city of London. Basically, it caters for every possible condition. A socialized healthcare system available for everyone and free for everyone, regardless of your social economic status. They used to impart with us that this kind of healthcare system is actually the best in the world. And I, as a young doctor back then, wanted to become a part of this healthcare system.
Once the COVID outbreak started, we all were put onto a new rota that combined all of the surgical doctors at our level of training, where we would then start rotating around the same wards.
But we know that we were fighting something that we don't know much about. A lot of our patients, if they were old, let's say they were more in their 70s or older, and they had other medical conditions, they would not be taken to the intensive care. And when things go for the worse, we just resort to palliative treatment, which means keeping them as comfortable as possible, keeping them calm, and being for them during their last moments of being alive.
So initially with Clap for Cares, I was quite happy about it because we were getting some kind of recognition. But then I think as the weeks went on and it kept happening every Thursday, okay, you know, we need something else. We need PPE, we need money, we need funding, and this is, you know, the NHS has always been underfunded. This has always been a problem. Why are we only getting recognition now? So then I think as the weeks went on, I got a bit frustrated with the clapping, to be honest.
Thing is, I'm training to become a surgeon. As much as you can say like, oh, I've read about palliative medicine when I was studying, or we've probably had some palliative care modules, but we are not trained to become palliative care physicians. We don't do it every day. We haven't, I mean, the last time I was working in the cancer unit was during my first year of being a doctor. And that was what, 4 years ago now?
I'm not part of any charity. Since this thing started, I've been doing it from 3 till 11 every day, 7 days a week. And that's after I finish work. So I'm gonna give out 4 pallets, and then I might leave 1 pallet downstairs for cleaners and all that. It's my own diesel, my own time, everything.
So the letters, the drawings, and the food that we got, I mean, I appreciated all of that. I think that was amazing. The support that we got from the community was lovely. We had little children drawing us rainbows and putting it on their windows. I loved that. I loved going to work and seeing those rainbows. It made a bit of difference. But it didn't stop the fear of obviously going there and being exposed to a potentially lethal virus.
We're also fearful for our lives because apparently there's this national shortage of personal protective equipment.
Everyone should use this equipment, use the equipment they clinically need in line with the guidelines, no more and no less.
When we don't get the appropriate PPE to protect ourselves when we're handling patients with COVID-19, I feel more scared because I think I'm putting myself at risk every time I go to a patient to examine them or to check how they're doing.
So there was a protest last Saturday in Hyde Park, and that just made me really mad. I saw a lot of footage on YouTube.
I think seeing all of these people protesting, apparently wanting their freedom and saying that COVID-19 is a conspiracy, it makes me really angry. Like how selfish these people can be. People are continuing to go to work in the NHS, and over 100 of them haven't come back home to their families because they have died. And they did that in order to look after other people. I think it's disgusting.
I wish they could also see like how this disease, how COVID-19 affects a person, and how a person would really struggle if they are deteriorating of that disease. Then maybe they will realize that even though they are able to go back to their normal, pre-COVID living, they put a lot of those who are vulnerable, even children, their loved ones, they're putting them at risk.
I tested positive for COVID-19. I had become unwell, and I was getting symptoms like suddenly being incredibly breathless, just walking up and down the stairs in my home. Luckily, I got better and it was all fine. But again, when you see what's happening to other people and people who aren't getting better from it, it's pretty scary.
I've just finished my shift this morning, and now we're going to St. Mary's Hospital to attend the funeral service of a Filipino nurse who unfortunately have passed away due to COVID-19. She's been working as a nurse in St. Mary's for the past 18 years. And she's well loved by a lot of people, and she's quite a senior member of staff, so they're doing this for her.
Receive, we pray, Medicine, into the arms of your mercy. You alone are the Holy One, you are mercy itself. By dying, you unlock the gates of life for those who believe in you. Forgive her sins and grant her a place of happiness, light and peace in the kingdom of your glory, forever. Amen.
I think it was heartbreaking. I recently found out that also at my previous hospital where I worked, the HCA, called Ruben Munoz, had also died. As a person of colour, knowing that those from BAME backgrounds are being disproportionately affected by this, and we're having more deaths, I think that's even more upsetting.
I feel confident that, whatever comes our way, we can get through it. We've kind of all dealt with it together, whereas like a war, you're kind of fighting between countries, whereas here we're fighting one common enemy, and we're all sort of sharing scientific advice, sharing any new vaccine updates, and I think that's kind of nice to see sort of within the world, that we're all sort of like trying to help each other rather than working against each other.
At times the job is really hard, and we find it that way, and I know that there's been some times where it's become so hard that you wonder, really, is this the job to continue doing? Is it worth everything that we have to put into it to be able to be doctors? And actually, this time and seeing how much good has been done and how much of a family the NHS is almost, I think reinforces how there's no other job like it. And I couldn't imagine myself kind of doing anything else.
I think it's part of our oath, that we took when we became physicians, to help those who are ailing, to help the sick, to cure and to comfort people who are unwell. And I think when you think about it, that's what we are trying to do here. and that's very true to our calling as doctors. And that itself motivates me every day when I go to work. It pushes you to do more and to be braver in dealing with an enemy that is invisible and nobody is able, as of now, yet to find a cure.